Hi guys, today we'll be talking about the difference between the hand of benediction, a pointing finger sign, and the ulnar claw hand. So, what is the difference between all three? So, you know that the pointing index finger sign and the hand of benediction is caused by median nerve injury, and the ulnar claw hand, as suggests in the name, is caused by ulnar nerve injury. So, as you can see, this is the hand of benediction which popes do while addressing a crowd and stuff. So, coming to the meat of the topic, before getting to it, we just learn the function of the lumbricals. This is important for the entire discussion. So, the main function of the lumbricals is to flex the MCP and extend the PIP and the DIP. Basically, this remember when you do this dance, this function of flexing like this and extending the digit is basically the function of the lumbricals. The lumbricals originate from the FDP tendon on the volar side, and they go and attach to the dorsal digital expansion on the or the extensor hood on the dorsal side. So since they go from the flexor compartment side to the flexor compartment side to the extensor compartment side, they flex the MCP and extend the IP. You can see clearly in this diagram how it goes from volarly and goes and attaches to the extensor hood dorsally. Okay, so that is why they flex one joint and they extend the other basically. So this is a good example of my hand where I'm showing the Benedict's hand, the ulnar claw hand, and the pointing index. So Benedict's hand, you can see the index finger and the middle finger are fully extended at the MCP, and there's flexion at the MCP of the little. I'll just stick to the digits. Fourth and fifth digits are flexed at the MCP, and they're flexed at the DIP, and a little bit less at the PIP. I'm flexing a little more here, but it won't be this bad. Ulnar claw hand, you can see the again with the middle and the index finger they're extended and not at the MCP and the PIP and DIP, whereas the fourth and fifth digit they're hyperextended at the MCP and flexed at the PIP and DIP. You can see a hyperextension at the MCP and flexed at the PIP and DIP. Pointing index, in addition to the hand of benediction, the index finger is extended at the MCP, PIP, and DIP, but there'll be slight flexion at the MCP and the PIP of the middle finger also. So, why does this happen? I'll come to it. So, the first difference between all these things, most importantly, the hand of benediction is a performed test, it is an active test, whereas the ulnar claw hand is the resting position of the patient, which means the patient will come to you with his hand already clawed in case of ulnar claw hand, whereas the hand of benediction occurs in case of a patient with median nerve injury when he is asked to make a fist. When you ask him to make the fist, the hand of benediction slash the pointing finger sign occur. Secondly, as by now, if you would have realized, the hand of benediction and the pointing finger sign are exactly the same thing. It was named the hand of benediction, which is slightly incorrect because in the hand of benediction, the middle finger and the index finger are fully extended at the MCP, PIP, and DIP, whereas during a pointing finger sign, there is slight flexion at the MCP and the PIP and the DIP of the middle finger, whereas the index finger still remains straight. Okay, so the hand of benediction and the pointing finger sign both occur in median nerve injury, and the ulnar claw hand occurs at when there's an ulnar nerve injury at the level of the wrist. Why did I specify the wrist here? Because if the ulnar nerve injury occurs higher up, imagine at the level of the elbow, what happens is, so as the ulnar nerve runs through the forearm, it gives off, in the proximal one third of the forearm, it gives off two muscular motor branches, one to the FCU and the other to the lateral two most heads of the FDP. The medial what I mean by that is the FTP to the fourth and fifth digit are supplied by the ulnar nerve, whereas the FTP to the first and second and third digit, which is the index and middle finger, is supplied by the median nerve. So what happens in the hand of benediction / pointing finger sign is, when you ask them to make a fist, since the FTP of the fourth and fifth finger and also FTP of the fourth and fifth finger are functioning because they are supplied by the ulnar nerve, and also the lumbricals to the fourth and fifth finger are supplied by the ulnar nerve. Okay, so the lumbricals of the fourth and fifth finger and the FTP of the fourth and fifth finger both are supplied by the ulnar nerve. The lumbricals and the FTP of the second and third digit, which is the index and middle finger, are supplied by the median nerve. So in a patient with median nerve injury, when you ask them to make a fist, the MCP and the PIP and DIP of the fourth and fifth digit fully flex. Why? Because the lumbrical and the FTP both are intact. So they are working. So he's able to flex this. Whereas the middle and the index finger, he is unable to flex these. Why? Because the FTP and the lumbricals are paralyzed. Even the FDS is paralyzed because the flexor digitorum superficialis is also supplied by the median nerve. Even that is paralyzed. FDS is gone, FDP to these two fingers is gone, and the lumbricals are gone. So these fingers remain in extension. Okay. Now, why is there a difference between hand of benediction and pointing finger? And why is the hand of benediction the scenario which happens less, and why is pointing finger sign the actual scenario which happens? This is because phylogenetically, as humans evolved, we know that the index finger was made mainly for opposition. So what happens with that is, in order to do this, so what happened with that is, as you can see in this diagram, the FTP slip to the third, fourth and fifth digit are common. The fascia of these flexor tendons are common. As you can see, the tendon to the index finger originates and runs separately. So what happens is, you can try it for yourself. When you flex the pinky finger and the ring finger, the fourth and fifth digit, the middle finger automatically flexes. Do it very slowly and you can feel it and even see it happen. Whereas the index finger does not flex because the FTP tendon is separate. Okay. Also, now you can extend this. Flex your middle finger. You can see when you flex the middle finger also, the ring finger flexes by itself. This is again because the flexor tendons have the same flexor tendon sheath, common flexor tendon sheath. So the third, fourth and fifth digits, if you flex either one of them, the others will also flex, whereas the index is independent and does not flex. So when a patient makes a fist, when a patient with median nerve injury is asked to make a fist and he flexes the fourth and fifth digit, the third digit also partially, weakly flexes. So this is what results in a pointing finger sign. Okay. So also I told you about the ulnar nerve injury, right? So the ulnar paradox. So the ulnar nerve, as it runs in the proximal 1/3 forearm, it gives off one nerve to the FDP and one nerve to the FCU, flexor carpi ulnaris, and the flexor digitorum profundus, lateral two heads. And as it runs further down in the wrist, it supplies the muscles of the hypothenar eminence and lumbricals, intraossea and all that. So imagine it is paralyzed at the level of the forearm. I mean, there's injury at the level of the elbow. The nerve supply to the FDP is also cut off. The FTP is cut off, and the lumbricals of the fourth and fifth digit are also cut off in terms of ulnar nerve injury. So what happens is, there is less flexion at the digits and this hyperextension at the MCP. Whereas at the level of the wrist, the FDP supply, which is already given off in the forearm, is spared. So the FDP is still active. So the fingers also flex at the PIP and DIP along with hyperextension at the MCP. So this is the ulnar paradox. So when there's a higher nerve injury, there's less deformity, and when there's a lower nerve injury at the level of the wrist, there is more deformity. Okay, thank you.